I chose the field of obstetrics and gynecology after I delivered a baby in the third year of med school. And along the lines of my training and my work, I was often called to examine women in emergency rooms, ICUs, and in various other floors of the hospital where they really were not set up for gynecologic exams. So that required me to do an examination in the patient's bed under suboptimal conditions. Just to describe what those conditions would be, let's take the ICU, for instance. The patient might be hooked up to a ventilator, there might be IVs. We would have to move that entire apparatus with the patient into an exam room at another part of the floor. And that would take about 4 to 5 nurses plus myself to do so. Many nurses had insisted I simply put a bedpan underneath the patient just to elevate her perineum, her bottom off the bed so I could insert a speculum and do whatever it is I had to do. Invariably, the patient might be bleeding, requires a biopsy, and it's very difficult to do these things under those circumstances. So I started thinking there must be a better way to do examinations. And the same thing occurred in the ER, the emergency room. Just to move the patients through the ER, the nurses wouldn't wait very often for a GYN room to be available, or the docs wouldn't wait for it. They just wanted to get the patient examined, get her treated, and get her back home or to work or wherever she was going. They too would put a bedpan underneath the patient. It's a completely undignified way to examine a female patient. And I started thinking, gosh, maybe there's a way I could make that better and somehow examine women in their bedside. Thus, GynoCart was born. The development of GynoCart was actually something I became very passionate about. I love solving problems. I started thinking, how could I examine a woman at the bedside? I started thinking, could I sit there? Could I somehow have the nurses hold her legs? Oh, wait a minute, maybe I could have equipment inside the cart, or even better, maybe I could have a stool to sit on. I started building one. I built a box and I put wheels on it and I put doors on it and I put a stool in it, which was actually a box with a cushion, but it was a stool to me. And I built some rudimentary stirrups. And I fine-tuned it, and finally I built what I thought would be a working model. Out of wood I got from Home Depot, and it didn't look wonderful like it does today, but it worked. And I sent it to an engineering firm, and I asked them, can you build this and make it look right? And they did, and that's how GynoCart was born. There really was an empty niche, and I feel that GynoCart filled that niche. It really provided a dignified, optimal way of examining a female patient under suboptimal conditions. We didn't have to move the patient to an exam room. The women in the emergency room didn't have to wait for a gynecologic exam room to be available. If they were using gynecologic stretchers, let's say, which are common, there's invariably someone else on it, and the woman who needs that stretcher just doesn't have access to it. So they would have to move that patient off that stretcher, move the woman onto it, and this took quite some time. GYN exam rooms had to be disinfected in between patients. All of this adds delays. And frankly, it takes me 5 to 7 minutes to examine a woman, do whatever it is I have to do, and she'll be waiting 3 to 4 hours to get into that room to see me. It's just not workable. Everything else required of a gynecologic exam suddenly is brought to the patient's bedside, and I can get her out of the ER much faster with this. That's what I feel I achieved with GynoCart. What the GynoCart does for facilities is it says this facility is an advocate for women's health. They're interested in taking care of women expeditiously, moving them through the emergency room quickly. It sends a message. Your care is going to be first class here. It brings dignity to the exam, it brings efficiency to the exam, optimization for the examiner. I can do everything I have to do at the bedside without transporting the patient elsewhere. Nurses can become advocates for GynoCart by driving the presence of the GynoCart in their facility. They can go to their directors and say, we have found a way we can bring a dignified, optimal exam and get those Press Ganey or satisfaction surveys up into a range that shows we're a facility that cares about women's health care. And we can be advocates for women's health care. That's what nurses can do. They're in the trenches. They're at the forefront. They're the ones who can go to their director and say, we need this. We have within our grasp a way of bringing a dignified, optimal examination to any female patient who has a gynecologic problem and shows up in our healthcare facilities. We have a way of getting them through the emergency room quickly. We can bring a dignified exam to them. Never again should we have to put a bedpan underneath a woman in order to do a gynecologic exam. No woman should ever be subjected to that. She should have the same caliber exam she gets at her gynecologist's office at any bed in any healthcare facility in our nation. If there are healthcare providers striving to enhance women's healthcare and the dignity of an examination, I would encourage them to look into obtaining a GynoCart for their facility and utilizing it and watching how it moves women through their emergency department much faster than they're currently doing. Women often will not get the care they need in an emergency room in a timely fashion. We can be the mechanism for change. This simple device that brings the examination to the patient's bedside can start helping healthcare providers become better advocates for women's healthcare. That's what I see, and that's what I would advise. Doctors, nurses, nurse practitioners, midwives, anyone who examines female patients to consider doing for their facility.